Successful town hall meeting in which we engage the community regarding the vaccination rollout in St. Kitts and Nevis. As of this afternoon, we had just under 6,000 persons who have been vaccinated. That brings us close to 18% of our target population, which we need to have vaccinated to achieve herd immunity. Tonight's session was to bring the information to the people in a manner in which they have the opportunity to share their concerns, to express their fears, and to have them answered by the professional and the experts in the health ministry. I want to commend our Medical Chief of Staff, Dr. Cameron Wilkinson, our Permanent Secretary in Health, Dr. Dolores Stapleton Harris, and of course the District Medical Doctor, Dr. Bernice Nisbet, for participating in this very rich experience for the people of the community of St. Paul's and the adjoining areas. I think this has been highly successful. We had a sense of joy. We, at the end of the question and answer period, a number of persons moved forward to have their vaccination. That tells me that it was very persuasive, it was impactful, and it has helped. And I know these persons are going to be ambassadors. They're going to be out there with their own experience, sharing with others, and as a consequence, we're going to have more persons participating in the program.
I will take.
Is on.
Of the National Emergency Operations Center COVID-19 briefing for today, Thursday, the 30th of December, 2021. I am Michelle Rodriguez, Public Relations Officer at NEMO, hosting in the absence of Director General of SKNIS, Mr. Lesroy Williams, who is otherwise engaged at this moment. As usual, these briefings are designed to give regular updates in relation to the management of COVID-19 pandemic here in the Federation. Also, it provides a forum where you, the viewers, can ask questions and seek further clarification on the matters at hand. I will now acknowledge the presenters for today's briefing. Chief Medical Officer, Dr. Hazel Laws, and the Superintendent of the Royal St. Christopher and the Nevis Police Force, Cromwell Henry. I will now invite Dr. Laws to give her report. And you are also welcome to send your questions at 1-869-668-3739.
Thank you, Michelle, and a pleasant good afternoon to everyone. We welcome you to the special edition of the NEOC COVID-19 briefing. It's my task to share with you the Health Emergency Operating Committee's situation report for today, Thursday, December 30. We are presently in the fourth wave. We are presently experiencing the fourth wave of COVID-19 infections, we can safely say that this wave started last Friday, Christmas Eve. If you've been monitoring the information disseminated by the Ministry of Health, you would recognize that there is an uptick, a surge in the number of newly diagnosed cases each day. Just yesterday, we reported an additional 41 cases. So when we look at this past week, starting last Thursday to present, we've added 103 newly diagnosed cases of COVID-19 to our tally. Now, this brings our total to 2,918. In terms of hospital admissions over this past week, we've only had one, and no discharges, and we have not added any additional COVID-19 related deaths. And so this is our summary slide. This gives you a snapshot as to the COVID-19 status currently. So far, the Federation has reported a total of 2,918 confirmed cases of COVID-19. We continue to enjoy an excellent recovery rate. We have noted 2,784 recoveries so far. So at present, we are monitoring 106 active cases, 25 of these cases on the island of Nevis and 81 of these cases on St. Kitts. So far, we've had a total of 28 COVID-19 related deaths, and at present, just one case admitted at the JNF General Hospital. In terms of the 2,918 cases, based on our analysis, 68% of these cases are unvaccinated. Only 25.5 or 26% are fully vaccinated, and the remainder, about 6.57%, are partially vaccinated. So it remains a disease impacting the vulnerable and the unvaccinated amongst us. So I want to use this plug to reach out to those who are not yet vaccinated. Empower yourself with the latest information and come on board and, have enjoy a level of protection against COVID-19 by consenting to the vaccine. Our vaccination program continues. In 10 months. We have achieved the following coverage rates. 81.3% of the adults in our population having come forward to receive the first dose, and 75.7% of the adults in our population are fully vaccinated. In September, we started offering the Pfizer-BioNTech vaccine to our teenagers, 12 to 17 years. So far, 16.2% have received the first dose, and 14% are fully vaccinated. In terms of the boosters, I want to congratulate the older adults amongst us and those who felt vulnerable and who have come forward in terms of accepting the booster shot. 5.1% of the adults have come forward so far and are boosted. In terms of the total population, 54.4% of the total population in the Federation fully vaccinated. And so you can look at the table, you would see the figures disaggregated by island. And so this gives you an idea as to where we are at. I just wanted to congratulate the population. It's the second to last day of the year in terms of you're empowering yourself with information about the vaccine. You're coming forward in accepting same in terms of providing us that coverage because we are now in the fourth wave. But I want to just underscore that we still have about 45% of the population not yet fully vaccinated. And the virus is going to continue targeting the unvaccinated amongst us. The Omicron variant came to the fore towards the end of November. It has been labeled a variant of concern by the World Health Organization. And so the main reason for this afternoon's emergency press conference is to inform and update the general public about the results that we have just received. And so on December 22nd, the Federation sent off a small package, 3 samples to the Caribbean Public Health Agency for genomic sequencing. You may ask why just 3 samples? We were down at an all-time low in terms of our daily case counts, and these 3 samples met the criteria for genomic sequencing. 2 of the 3 samples returned positive for the Omicron variant of concern. I repeat, 2 of the 3 samples returned positive for the Omicron variant of concern. Now, so this provides us, when we look at the data pertaining to these 2 samples, the 2 cases, we have objective evidence that the Omicron variant is in circulation in the Federation currently. The Lambda variant has been in circulation for the past 7 months, and so we have 2 variants in circulation, the Omicron variant and the Lambda variant in circulation currently. So what's the latest information about Omicron? Now, this variant was first identified in South Africa towards the end of November, beginning of December, but it's spreading rapidly. Over 100 countries, territories globally are already impacted. It's spreading like wildfire. Omicron carries a number of mutations not seen in the previously identified variants. Based on the scientific data regarding this variant of concern, we must note that Omicron is much more transmissible versus the Delta variant. And so we need to be very careful. So if you are in the presence or company of somebody infected with Omicron, it's highly likely that you will be impacted. Current detection methods continue to be adequate in terms of the diagnosis of disease or COVID caused by Omicron. So in other words, the PCR tests and the rapid antigen tests are still able to diagnose Omicron, meaning most of the rapid antigen tests. I think the CDC has identified a number of rapid antigen tests that are not effective in identifying Omicron. Anecdotal evidence so far suggests that the disease caused by Omicron is less severe versus the disease caused by Delta variant. And so this is the ray of hope as we discuss and consider the potential impact of Omicron. So it's much more transmissible than as compared to Delta, but the disease it causes seems to be less severe. So the World Health Organization warned yesterday that the ongoing circulation of the Delta variant and the emergence, the rapid spread of Omicron can cause a tsunami of infections, which has the potential of overwhelming the health system. So we have to be careful and not trivialize Omicron. The global average of new cases hit a new high with more than 930,000 cases this past Tuesday, December 28, according to the New York Times database. The previous high was about 827,000, which was realized in late April of this year. So the Delta and Omicron are now twin threats, driving up cases to record numbers, leading to spikes in hospitalizations and deaths in some countries across the globe. But the good news is that the COVID-19 vaccines still appear to be protective. the vaccines still provide a significant level of protection against severe illness, hospitalizations, and death. The Omicron outbreaks around the world started primarily in younger age groups, and the variant is now impacting older populations. So what you find is the younger persons in households take it home, and it impacts the older adults who are chronically ill and who are otherwise vulnerable. Early data suggests a booster shot is needed to restore protection against Omicron. Though the initial vaccine regimen might still be enough to fend off severe disease, people who survived a prior case of COVID appear to be at risk of reinfection from Omicron. And so, in essence, we need to be vaccinated. Vaccination provides significant protection against moderate to severe disease, hospitalizations, and death. And persons who've had COVID before, in terms of in our population, persons would have been infected with the Lambda variant. The risk of reinfection with Omicron is still noteworthy. Now, in the United States, because it's a source market, we need to realize that the variant is now detected in all of the 50 states, and that the Omicron variant has surpassed the Delta variant and is now the dominant variant. So the most prevalent variant in circulation in the US is now the Omicron variant. The highly transmissible variant is causing near vertical case growth in multiple US states, with figures doubling about every 2 to 3 days. The US is expected to reach 1 million cases in a day. So this just gives you an idea as to what's happening in the US. Most of our visitors are originating from the US. So here in the Federation, what's the way forward? Well, we are continuing our COVID-19 vaccination program. So the Ministry of Health is being intentional in targeting the vulnerable amongst us, meaning the older adults, those with chronic diseases, those who are immunocompromised. We are intentionally targeting them and bringing them on board in terms of even just the primary vaccine series. We are collaborating with the Ministry of Education in targeting our teenagers, because the vaccine is available for the 12 to 17-year-olds. The coverage rate is still below what's acceptable for us, and we really need to push vaccination amongst our teenagers, because they are now vulnerable, and the potential is for the Omicron to take hold on or impact our teenagers. Now, the Newtown Health Center will be open on Sunday, January the 2nd, between 1 to 5 p.m., and again on Monday, January the 3rd, between 9 to 1 p.m. To facilitate the administration of the COVID-19 vaccines. And so we want those amongst us to capitalize on this opportunity in terms of getting vaccinated and protecting yourselves. We are increasing the testing opportunities for persons who are experiencing COVID-like symptoms. And so if perchance you're experiencing fever, sore throat, sniffles, coughing, and if you think you've been exposed to COVID, you can come out to the Bastia Health Center car park, the Mary Charles Hospital car park, and Poxon Hospital as outlined. And so on Tuesday mornings, 6:30 to 7:30 a.m. Bastia Health Center. On Wednesday morning, 6:30 to 7:30 a.m., Poxon Hospital car park, and on Thursday mornings, 6:30 to 7:30 a.m., Mary Charles Hospital car park. I repeat, Tuesday mornings, 6:30 to 7:30 a.m., Bastia Health Center car park. Wednesday morning, 6:30 to 7:30 a.m., Poxon Hospital Car Park. Thursday mornings, 6:30 to 7:30 a.m., Mary Charles Hospital Car Park. And this drive is to facilitate testing for persons who are experiencing COVID-like symptoms. In terms of physical and social distancing, now it's the second to last day of the year. Tomorrow is All Year's Day and New Year's Eve, and it's a time of, persons coming together, socializing. And so it would be, I can't say to avoid interacting with persons at this time of the year, but I want us to be wise and use our discretion as we choose to socialize and get together to interact with our friends and loved ones. So I want to use this opportunity to reach out to organizers of events and functions. Please note that we have objective evidence that the Omicron variant is in circulation. It's highly contagious. And if you have one individual amongst a group who is infected with Omicron, chances are the others in that group, they are at risk of becoming infected. And so we need to be mindful of the number of persons that you are inviting to whatever event, function, social gathering, family gathering. Please note the space or the area that you are going to be using and make sure that the number of persons you are inviting, that you bear in mind the need to have a space, adequate spacing between individuals. And these events and functions should be held in well-ventilated spaces. Open air spaces are recommended. And we want attendees and patrons to wear a face mask. It's preferred at this time, seeing that Omicron is so highly contagious. If you have access to the surgical face mask, it offers a significant level of protection. If you have to wear a cloth mask, you could double it. Wear 2 masks. It would provide you an increased level of protection. And please do maintain adequate hand hygiene. Keep your hands away from your face. And so as we approach the end of the year celebrations and the New Year celebrations, we want you to bear all of this in mind, recognizing that the Omicron variant is highly contagious. In other words, you don't even have to interact significantly with somebody who is infected to become infected. It could just be a casual passing interaction, and the risk of you becoming infected is significant. So that's how highly contagious the Omicron variant is. And so wearing of the face mask at this time is of paramount importance. Please don't let your guard down. And so if you're out socializing, what I've been doing is, I attended a luncheon yesterday, and I kept my mask on between bites and between sips of eating and drinking. So that's the level of precaution we want you to attain to as we work our way through this 4th wave. You must maintain hand sanitization, hand hygiene, keep your hands clean. So once you've transferred, given somebody something or taken something from someone, touched a high-touch area, make sure to sanitize your hands. And of course, the vaccine. If you're not yet vaccinated, and if you feel vulnerable, and 6 months or a number of months have elapsed between your last dose and present, you can come forward and be boosted. And try as much as possible to maintain a safe distance between yourselves and others when in a social setting. I want to utilize this opportunity to wish the people of the Federation a Happy New Year. I want to also say thank you to our people for your support throughout 2021. You've supported us here at the COVID-19 Task Force and the Health Emergency Operating Committee, you've provided us support in terms of our response to the COVID-19 pandemic. And you've come on board in terms of the all of society approach in our response. So we want to thank you. And at this time, we want to wish all of us a happy new year come Saturday. And I want to wish us all a better 2022 versus the 2021 that we've just gone through. So again, happy new year to everyone. Thank you.
Thank you, Dr. Laws. Before Superintendent Henry comes to present, I wish to remind you, our viewers, that you can send your questions at 1-869-668-3739. Superintendent?
Thank you very much. President, good afternoon to all listening to this broadcast via whatever means. As expected, we are at the beginning of the fourth wave of community spread of the coronavirus in the Federation. It should be no surprise to us as we have had all the information needed to prepare us and to protect us. And so today I will just be reminding you of what you should have already known. We know that the virus is spread through person-to-person contact when the necessary prevention measures are not adhered to. We also know that we are at a time of year when we drop our guard and socialize to celebrate Christmas, Carnival, and the New Year. For December alone, the Commissioner's Office has received 425 applications for social events. 351 have been approved. And so far for January, we have received 228 applications, of which 209 have already been approved. And these are for St. Kitts only. We see, therefore, that there are plenty of opportunities for persons to come together in ways that increase the risk of spread of the virus. We therefore ask organizers to strictly adhere to the conditions of the permission for your events. Those events where only vaccinated persons should attend, we ask that the vaccinated records be properly checked and verified the holder's identity by requiring the presentation of a government-issued ID. The compliance team and police officers will step up their enforcement activities to ensure compliance with the regulations. I just want to bring to your attention that there is a note circulating purporting to come from the police indicating that all events have been cancelled. Please note that this is not true. Neither the police nor the task force has taken the decision to cancel any event at this time. Instead, we are asking persons to be responsible and to adhere to all the prevention protocols outlined in the regulations and of which you are all well aware. Wear face masks when in public, practice good hand hygiene and sanitization behavior, maintain a physical distance of 6 feet from others when in a social setting, and more importantly, get vaccinated to reduce your risk of infection and severe illness. At this point, I just want to take the opportunity to, on behalf of the Commissioner and ranks of the Royal St. Christopher Nevis Police Force, to wish everyone a very safe rest of the Carnival season and a blessed and prosperous New Year. Thank you.
Thank you, Superintendent. And I wish to acknowledge the Attorney General in our presence, the Honorable Vincent Byron. The NEOC St. Kitts and Nevis Chairman, Mr. Abdia Samuel, is currently on vacation and will not be presenting this afternoon. So we will be moving straight into our question and answer segment. First question, can you please give a breakdown of the present active cases of who is vaccinated and who isn't?
Of the cases who are unvaccinated. Okay, so in my presentation, the data I presented is up to date. So of the 2,918 cases, 68, which includes the most recent ones, 68% are non-vaccinated, 25.5% fully vaccinated, and 6.5% partially vaccinated. And so 68% of the cases unvaccinated.
Just before you go. This question actually they requested for you to answer. Regarding returning nationals who had COVID while off islands but recovered and has no symptoms, is it true they can test positive for a few months after? If so, what is the process for the national be able to return home? For the national to be able to return home?
Okay, so our experience is persons who test positive for COVID-19, they recover fully, and when tested, the RT-PCR test returns to negative. So we do not have an experience whereby we had persons who recover and continue to be testing positive when an RT-PCR or even a rapid antigen test is done. So in short, our experience is if you are diagnosed with COVID-19 and you test positive after time period X, you recover, and when that repeat COVID-19 test is done, RT-PCR test, it usually reverts to negative. And so we do not have an experience where persons continue testing positive continuously for months. So that's not our experience.
Someone is asking, would you please remind us the length of quarantine if tested positive in light of Omicron variant?
All right, so if you test positive for COVID-19 at this time, you go into isolation, and you remain in isolation until you recover. And that recovery is marked by a negative test, RT-PCR test. The duration of time, it depends on you, the individual, your immune status, and the time it takes for your body to fight the virus and for you to recover. What we are experiencing is that persons who are vaccinated and who become positive, they recover very quickly. In under 7 days, in less than a week, they recover and they are able to return. We usually get a negative RT-PCR test in under 1 week.
Thank you, Dr. Laws. The questions are flowing. In the presence of the Omicron virus on the island, how will that affect our schools, seeing it is highly contagious? What will be the way forward for our kids, especially those who will be sitting CXC exams next year?
One of the things that we've said all along is that the Federation of St. Kitts and Nevis is not immune to what is happening around the globe. And so we said right here that a fourth wave was inevitable, that it was only a matter of time before the Omicron variant came here. And the best defense we have is to get vaccinated. We see from the presentation today that while over 80% of adults have had at least one shot, and I think more than 75% are fully vaccinated, only about 16% of children between the ages of 12 to 17 have had at least one shot. The Ministry of Health and the Ministry of Education, we have been working for several weeks now to get persons to bring these vulnerable children forward to get vaccinated. We had PTA meetings with every single secondary school and most of the primary schools who would have had persons turning 12 and will be entering the secondary school system. And so the answer to keeping our schools open is to have the children properly protected, and the best protection is the vaccine. The clinics are open even over the 2 holidays coming up, and so I encourage persons to get vaccinated. One of the things that I've preached here also, despite the fact that there isn't a mandate for vaccination, every essential worker should be vaccinated. Teachers are essential workers, and the teachers themselves, they need to go out and make sure that if they're not vaccinated, they're vaccinated so that our schools can stay open.
Thank you, Doctor. Superintendent, I believe this question is for you. Does events going forward have to be fully vaccinated? Who will enforce this if it is so? Or what criteria is fulfilled for an event having to be fully vaccinated?
The Compliance Task Force and the police will continue to enforce the regulation with respect to the conditions stipulated on events. What is the criteria for events to be considered for vaccinated persons only? Well, the current regulation requires all social entertainment events that the attendees, the patrons, be fully vaccinated. And so we find that once you are having an event, an entertainment event, one of the conditions would be that the persons are vaccinated.
I would now like to invite the Honorable Vincent Byron to make a presentation.
Thank you very much, Madam Chairperson. And I wanted to announce to all citizens and residents of St. Kitts and Nevis that at this point in time, we have been under a state of emergency for some time now. In June of this year, the Parliament would have extended the state of emergency for an additional 6 months. The state of emergency would come to an end at the end of the 31st of December. That's at the end of tomorrow. Under the state of emergency, we have had a number of subsidiary legislation, regulations that have established the various restrictions and guidelines by which the people of St. Kitts and Nevis have sought for protection to curb the spread of the virus and for us to be safe. When this state of emergency ends tomorrow, it would not be the end of the restrictions, because we would then be covered by an Act of Parliament, the COVID-19 Prevention and Control Act, number 16 of 2020. This was an act that was passed last year, November, and which was done to give a framework for our health experts, our medical teams, for various technical people in our country, the national security services, the police, the defense force, and others, to be able to guide the response to the COVID-19 pandemic. It allowed us very much to restrict the movements of persons when we had what was known as lockdown. Without the state of emergency, we could not enforce a curfew, or for that matter, a lockdown. And as the year has unfolded, as we have got to better understand how to treat with the COVID-19 pandemic, we have removed the curfew. We have not had a lockdown for some time, and we hope and pray to God that we don't have to return to that. So, on January the 1st, we would have new regulations, but these regulations would be based on the COVID-19 Prevention and Control Act. These regulations would be able to help to manage the entertainment industry, for instance. They would be no different from the regulations that have been proclaimed under the Emergency Powers Act. It allows entertainment events, as Superintendent Cromwell Henry has said, to be applied for via the Commissioner of Police. It allows for limiting the number of patrons, which is 75% of the capacity of the location, and the capacity of the location would then have to be managed where we allow one person to every 6 square feet, and when we have that number, it allows for 75%. That number should be posted on the walls of the entrance of the location. So we manage how people mingle and mix. There's some social distancing so that we can control the transmission and spread. But it still allows our entertainers to ply their living. It allows us to have events and functions once they are approved by the Commissioner of Police and his team, having consulted with the Chief Medical Officer. It allows these new regulations for street vending to be removed. That has been established, and we have to thank our people for having conformed and complied. We now have the Bastia Public Market being properly utilized. Once again, we now have the streets of Bastia being free of vendors. We now have vending locations such as the pasture on the Figueroa Road by Ponce Pasture. But these restrictions, these directions, these guidelines that have been made some time ago under the Emergency Powers Act, they continue under the new regulations. And the new regulations will also guide and give direction to regional and international travel. You would still have to, you must be able to apply via the SKNA travel form that's online when you want to enter St. Kitts and Nevis. This is a means by which the National Security, the Ministry of Health, Immigration, Customs are all able to control and manage those who enter our shores, once for the protection of our people and to ensure that it runs properly. So you will be expected, as Dr. Laws has explained, you'd be expected to have a negative PCR test up to 72 hours before you fly. You are expected to be fully vaccinated if you are non-national. Nationals should also be not fully vaccinated, but those who are not, you are permitted to enter St. Kitts and Nevis unvaccinated, but you will be restricted to quarantine rules that still mandate that you be quarantined for 9 days. That in order to leave quarantine, you'll have to have a negative PCR test. The rules that have been in place over the last iteration of the SRNO number 44, the Emergency Powers Regulations, would still be in force, therefore. We would want to urge all our citizens to have extreme caution this season. True, we are celebrating 50 years of Carnival, but we must do so in a safe manner. We should wear masks, and we should be careful of how we interact in crowds. Be conscious of it. It does not mean that we cannot attend functions. It does not mean that we cannot enjoy ourselves, but we must be very, very cautious and very careful that we now have a variant of COVID-19 that is quick to be contracted, to be transmitted, as we will do everything in our power. Non-pharmaceutical measures that we have been speaking for over a year and a half. Washing your hands, sanitizing, social distancing, wearing your masks. And those of you who are not vaccinated, you must make an appointment to get vaccinated soonest. Sites are open, it is free, and you need to get vaccinated for your protection and those around you. So, we have now come to the end of our state of emergency. We believe that it was a tool that was critical to keeping us safe. When we needed to have a lockdown, we needed to have the state of emergency. And that was effective. When we had that third wave, I think it would have been after May the 19th, we went to a lockdown. And it went a long way to break the cycle. Curfews also helped us to keep us separated, and we needed the state of emergency to have a curfew. If we have to have a widespread outbreak, we will have to consider whether we go and use this tool again. But for now, we believe as we open up, as we manage, that it is not necessary at this time for us to extend the state of emergency. And so I wish everyone a Happy New Year when it comes, that we continue to have a good holiday season and we stay safe. Thank you very much.
Thank you, Honorable Vincent Byron, and I wish to acknowledge the co-chair, the Honorable Wendy Phipps. There are, okay. The next question. Sorry. How soon can vaccination be available to children under 12 years?
The Pfizer-BioNTech vaccine is available to children under 12 years. As a federation, we've submitted our request through the CARICOM Secretariat. So it's made available to CARICOM member states through the CARICOM Secretariat, and so we are awaiting our supply. We do not have a timeline as yet.
Question from WinFM. Has the Ministry of Health sent off additional samples for genomic sequencing? If so, how many?
The last batch, we just shared the results of same. They went off December 22nd. The next batch goes off next week, Wednesday.
Thank you, Dr. Laws. Are the symptoms for Omicron the same, flu-like, or is there diarrhea, vomiting, etc.? Also, I think people have forgotten all possible symptoms and may think they have a mild flu and does not go to check. Please clarify possible signs.
The symptoms are essentially the same, though persons presenting with symptoms related to Omicron, they tend to be so far milder. And so persons may have headache, mild flu-like illness, etc. I saw on the chat going across the screen, persons who were asking, well, what happened to the flu season over the last couple of years? By wearing a mask and by hand sanitizing and social distancing, we have been able to keep the flu season basically at bay. And the same goes for Omicron or any other variant that may be circulating. And so, yes, if someone has a flu-like illness, it might be influenza as well as it might be COVID-19, and so you should go forward and get tested.
Someone from Nevis is asking if any health center will be open over the holiday weekend?
In Nevis?
In Nevis, yes.
We will check, and if we have information on that, we'll get back to you. Thank you.
Okay, thank you. What is the minimum size of gathering? Do we need, sorry, let me read that again. What is the minimum size of gathering? Do we need approval for? For example, if we have to have friends over for dinner, do we need approval?
If you're having more than 24 friends over for dinner, yes, you would require to have approval.
Okay, just sorry. Okay, somebody is asking, I believe part of this question was answered before, but I'll read it. Since the new protocols were put in place allowing travelers to come to the Federation without quarantine, how many imported cases we have recorded? Are there any evidence of any spread from any imported cases, if applicable?
I think it's important for me to give a little background before I answer that question, because we all agreed that we could not keep the country locked down forever. We all agreed that we could not maintain a 14-day quarantine or a 9-day quarantine as we got things under control and we moved towards balancing between lives and livelihood. Prior to us reducing the quarantine period to basically a negative test and you're able to move freely, we looked at the number of positive cases that we were getting when we had the 24-day quarantine, and we found that, I can't remember the exact figures, but it was less than 1% of persons who were tested to release were positive. And yes, as we move forward, we'll have to absorb risk, and the higher the population threshold of immunity, the more risk we'll be able to absorb. And it's impossible for any country to aim for zero risk, because zero risk means locking yourself in the basement, not allowing persons in the country. And so there are going to be positive cases that are going to be coming in with the new policy. One of the reasons why we said a fourth wave was inevitable, one of the reasons why we said the Omicron arrival was inevitable, because it will be imported, and it was imported. And so the variant came in here by someone who entered our country. But the virus is not like a concealed weapon that you can pick up at the airport and remove it. And so the best thing that we can do is what we keep repeating: protecting yourself with the non-pharmaceuticals and protecting yourself by getting vaccinated.
Thank you, Doctor. Someone is asking, can the task force say when fully vaccinated, locally based pilots will be able to return to work?
And that's something we'll have to look at and get back to you, because I was of the opinion that they were working already.
Let me just check one more. Okay, one more. Okay. Well, I do believe that brings us to the end of our question and answer segment. And I would like to thank everyone for tuning in today to today's emergency briefing as we continue to facilitate you with timely information on the management of the COVID-19 pandemic here in the Federation. We continue to urge you to follow the protocols to keep you, your family, and by extension, the Federation safe. We thank all our presenters for today. Chief Medical Officer, Dr. Hazel Laws, Medical Chief of Staff, Dr. Cameron Wilkinson, for answering some of the questions, Superintendent of the Royal St. Christopher and the Nevis Police Force, Mr. Cromwell Henry, and also the Attorney General, the Honorable Vincent Byron. I also would like to thank, being in our presence, the Court Chair, the Honorable Wendy Phipps, and our technical team, the ZIZ technicians, the Open Interactive team, all media communications, and our NEMA staff here at the NEOC. As we close, I would like to wish you, our viewers, a safe, happy, and successful 2022 when it comes. Thank you for listening. I am Michelle Rodriguez, Public Relations Officer at NEMA.